Welcome to Physician Focus. I'm Dr. Mavis Jaworski. With the exceptions of the seasonal flu and pneumonia, human papillomavirus hurts and kills more Americans each year than all other vaccine-preventable diseases combined. HPV is the most common sexually transmitted infection and can lead to genital warts, cervical cancer, and head and neck cancers, which claim thousands of lives every year. This edition of Physician Focus will discuss human papillomavirus, how it's contracted, its effects on health, who is most at risk for the disease, and treatment for the conditions it presents. We'll also look at preventable measures, including the HPV vaccine and its effectiveness and safety. Joining me for this conversation is Dr. Rebecca Perkins. Dr. Perkins is a board-certified obstetrician gynecologist at Boston Medical Center and an assistant professor of obstetrics and gynecology at Boston University Medical School. A graduate of Harvard Medical School, she has completed research on HPV vaccination projects sponsored by the American College of Obstetrician Gynecologists, the U.S. Centers for Disease Control, and the American Cancer Society. Welcome, Dr. Perkins. We're so glad to have you here on Physician Focus.
Thank you for having me.
Well, I know we want to first start off with, what is human papillomavirus?
So human papillomavirus, or HPV, is a skin infection. It is the most common sexually transmitted infection, but it can be really transmitted by any skin-to-skin contact. And that's why about 80% of people will be exposed to it at some point during their lives.
And what conditions can it be causing?
So HPV is actually classified as a human carcinogen because it causes not only cervical cancer, but also cancers of the head and neck, specifically the tongue and the tonsils, as well as cancers of the genital organs, including the vagina, vulva, penis, and anus.
You know, a lot of times people want to know if they have something, what will they feel when they have it? What would you say to that question?
So, unfortunately, most HPV infections are asymptomatic until someone develops advanced disease.
So, how do you find out if you have it?
So for women, there is an HPV test that is done during screening for cervical cancer, but it is not really possible to test for HPV in other parts of the body at this time.
So what is actually done? A specimen is taken from the cervix?
Right, so when a woman goes in for her Pap testing, the doctor in women 30 and over can take not only the specimen for the Pap test, but that same specimen can be used also to test for HPV.
A lot of times people prefer to have an easy way out, for example, a urine test or blood work.
No dice on this one.
Okay, great. So we've covered that one for sure. How common is it? We know it's fairly prevalent in the community, but just how common is it related to other things?
So it's estimated that 80% of people will be exposed to it at least once. So it's really, everybody has it, it's very common.
So if you're exposed to somebody who has HPV, what is the chance you're going to get HPV?
So HPV is actually incredibly easily transmitted. It is about 100 times more infectious than HIV and herpes.
Some people always ask the question, can you get it from a toilet seat?
Probably not.
Okay.
Although, because it's a human papillomavirus, you can't grow it in a lab, you have to grow it in a cell.
Okay.
But probably not.
Okay. And as far as, are there particular populations that are more at risk for it than others?
Nope. Everybody's at risk.
Ethnicity doesn't make a difference? Age doesn't make a difference?
Not particularly. In terms of age, when you look at how common it is to find it when you're taking a sample, the most common age at which you find it is in the early 20s.
Okay.
However, it can stay hidden in the body for decades, and then an infection that someone got in their 20s can pop out in their 40s and 50s.
So do women get it more than men?
No. Okay. Men and women have it equally.
How do you check men?
You really don't. There is
Okay.
not a test for men at this time.
And how do you keep from getting it other than the vaccine? Or what are your other options?
So condoms help prevent transmission of HPV, but they're not 100% effective for this condition because it lives on skin and condoms don't cover all available skin. And obviously safe sexual practices like limiting the number of sexual partners is also helpful, but even despite that, most people will be exposed to it.
And what is the first thing that someone should do if they think that they've got an issue, say with a growth in their oral pharynx or in their mouth? What should they be doing if they're concerned they might have HPV in the oral cavity?
So they should certainly go to their physician if they have any sort of a growth in the mouth to have that examined.
Where are some of the places, again, that you can also find this virus located?
So in terms of it causing problems, it can cause problems in the mouth, in the vagina and genital areas of men and women, as well as in the anus. In terms of finding it, in the research studies of college students, the most common place to find it was under the fingernails.
Under the fingernails?
Yes.
Wow.
It's everywhere.
Okay, that is profound. It must be everywhere.
It's everywhere.
That's quite a shocker. You surprised me on that one for sure. Okay, so let's say you're getting the vaccine and you're cleaning your hands well these days too, for sure. But let's say you're getting the vaccine. How many doses do you need to have effectiveness?
So it's recommended to complete all 3 doses to have full effectiveness. And that was the way it was tested in the trials, and that's the way it's given in all countries where it's recommended.
And what age should you start the vaccine?
11 or 12.
Okay, and then is that for male and female?
Yes.
Okay, and then what's the time lapse that you can have between doses?
So the recommended time is 2 months from the first dose to the second dose, and 4 months from the second dose to the third dose. So to finish the whole series in 6 months. That is the goal for everybody. It's hard sometimes to get adolescents in to finish it on time, and there have been studies showing that it is effective even if you do it at the second dose a year after the first, and the third a year after the second, so taking 2 full years to complete it.
What have you found in your clinical practice to be some of the most common misperceptions about the vaccine itself?
In my practice as a gynecologist, I really have patients eager for it because most of the patients I see I'm seeing for HPV-related problems, and they're looking for anything that may help prevent more problems in the future. In terms of questions from parents, when the vaccine was new, there were always a lot of questions about safety, since it was a new medication, which is certainly valid. And those have been put to rest at this point. It's a very safe vaccine, and there have been many, many studies to show that.
So how often should an individual have screening for HPV? Obviously, it's only females at this point. Will there be a time in the future that males will be screened, do you think?
The reason that we screen females for HPV, we're not looking for HPV infection, we're looking for it because it's a marker of a high risk for cervical cancer. Okay. And we really want to prevent cervical cancer. And so the recommendation is in someone who has not had a history of cervical cancer or cervical precancer to get an HPV test about once every 5 years, along with a Pap test, and that's called co-testing.
Okay. And any other misperceptions about the vaccine itself? Allergies, has there been any concern about allergies to it?
No, it's not. It's not like the flu vaccine, which is made in eggs, where people who have an egg allergy shouldn't take it. There's really no contraindications in terms of that. Unless someone has, had a reaction before. But no.
And then as far as the actual vaccine itself, maybe some local irritation, like you would get with any vaccine, I would think.
Right. So the common side effects are arm pain, like you would get with any vaccine, and it's definitely, people will get arm pain. About 80 to 90% of people have arm pain after the HPV vaccine, similar to other vaccines. And people can also faint after receiving any vaccine. Some teenagers will faint just looking at blood or looking at a needle. And certainly there is a risk of fainting after the HPV vaccine, and so it's recommended to stay in the doctor's office for about 10 minutes.
In the work that you've been doing on the HPV vaccine, what have you found most interesting? I can tell you right now what I found most interesting. If what you've said is the thing about under the fingernails, but what have you found that's been intriguing for you as a research scientist?
So the study that I found most interesting recently came from Australia. In Australia, they have vaccinated about 80% of their eligible females, and so they're really starting to show how well the vaccine is working in their entire population. And a study that came out in December showed that the vaccine was twice as effective if all 3 shots were finished by 14 compared with finishing them at 15 or older.
Some people, I'm sure, would like to think that this particular vaccine will protect them from many diseases. Are there any other diseases that you can be protected from by having the HPV vaccine?
So it is designed to, and we know prevents against, cervical and anal precancers, and should protect against other diseases caused by HPV, such as head and neck cancers and other cancers of the genital tract. It also protects against genital warts, which are also caused by HPV.
And my understanding is, too, with the HPV virus, there are several different serotypes about that.
Correct.
Can you discuss that briefly?
Yes, so there are over 40 different types that can infect the genital epithelium or genital skin, and the vaccine protects against 4. These are the most important 4 types. Type 6 and 11 cause about 90% of genital warts, and type 16 and 18 cause about 70% of cervical and other HPV-related cancers.
Have any people been, quote, resistant to the vaccine?
No. When it doesn't work, it's usually because they were previously infected.
Okay. And you don't test before giving the vaccine. Everyone gets it. You don't have to necessarily do the screening in advance.
No, it's not recommended to do any screening in advance, because that would wind up delaying vaccination, and you wouldn't know. The HPV test, it's a yes or no answer, so you don't know what types that person might be positive for.
So let's say here in the United States, all individuals get their HPV vaccines. What can we expect as far as the decline or the drop in the incidence of cervical cancer if everyone became compliant with doing this?
So right now we see about 33,000 HPV-related cancers in the U.S. every year. About 12,000 of these are cervical cancers. So you would expect a significant drop in cervical cancers to about 3,000 or 4,000 per year. About 4,000 women die from cervical cancer every year, and so you'd expect that number to drop to 1,000 or less.
And can the HPV vaccine impact fertility in any way? I'm sorry, and not the vaccine, the human papillomavirus.
So HPV doesn't specifically cause infertility the way chlamydia and gonorrhea can when they infect the tubes and cause tubal scarring. But if someone develops a cervical precancer, then they have to undergo a treatment that removes part of the cervix, and that can leave them at risk for preterm labor in the future. And
can an infant be born with human papillomavirus?
Yes, there is a condition called recurrent laryngeal papillomatosis, which is warty growths in the windpipe that require repeated lasers and surgery so that the infant can breathe, and those are caused by HPV 6 and 11. So a baby being born through a genital tract that carries those viruses, and those are protected with the HPV vaccine.
But typically in prenatal care, there would be screening and checking for, well, actually, you're not checking for HPV itself at that point, or are you?
No, it's not considered a contraindication to giving birth.
Yes.
Yeah.
Okay, great. Other pearls you'd like to share about HPV, the disease itself?
Really, I think the most interesting and somewhat disturbing research that's coming out is showing that rather than being an infection that comes and goes, like the common cold, you might get it in college and then it goes away and it never bothers you again. It really isn't true. It really can stay in the body for decades and then pop up and cause problems at ages 40, 50, 60. I recently operated on a patient who was 75.
Do you think in the future there will be vaccines for an older population?
No, because the way a vaccine works is it has to be given before exposure. Mm-hmm. Otherwise, it's a treatment. So if it's a vaccine, it has to happen before the person is exposed. So we need to vaccinate the 11 and 12-year-olds, those young adolescents, for two reasons. One, because they are unexposed, and two, because they actually form twice as many antibodies as kids once they get over the age of 15. So you get twice the bang from your buck in terms of no exposure and a much better antibody response.
That's great. Any other tests that are happening in the near future in regards to HPV? Any new types of screening tests maybe coming out?
So recently, HPV testing was approved by the FDA as a standalone test for cervical cancer screening. And this is not a new HPV test, it's a new use for the old test.
Old test.
And this is recommended at they're probably going to recommend it at 3-year intervals, although actually the interval has not yet been determined, and professional societies haven't yet given doctors guidelines on how to use it. So right now the guidelines are really for using Pap testing by itself or Pap testing with HPV testing together as co-testing.
So there's a possibility that you would only have the HPV test and not the actual Pap smear?
Right.
In the future,
so,
not now, but in the future. Now that's not the standard of care, so I want to be sure.
Right. So the screening algorithm that was put forward to the FDA was, instead of starting with a Pap test, you start with an HPV test. If the HPV test is positive, then you go on to the Pap test. Mm-hmm. So it's not that the Pap test is gone, but the Pap test is used second instead of first.
Mm-hmm. How did you become interested in this whole field of studying vaccines?
So I'm a gynecologist, so I really became interested in cervical cancer prevention. I worked in Honduras, where in the absence of screening, cervical cancer is the leading cause of cancer death for women. And prior to the invention of the Pap smear, it was the leading cause of cancer death for women in the United States, which again just speaks to the ubiquitous presence of this oncogenic virus. Mm-hmm. And so I became very interested in cervical cancer prevention, which led me to HPV vaccination.
And what are typical ages for people to have cervical cancer?
So the timeline of cervical cancer starts with infection, and then in about 5 to 10 years after infection, people develop precancer, and that's what we're aiming to detect and treat when we do our Pap and HPV testing. And so that peaks at about age 25 to 29. Cervical cancer then peaks about 10 to 15 years later, so you see your first peak of invasive cervical cancer in the mid to late 30s to mid 40s, and then a second wave around the age of 60.
And obviously you want to catch the cervical cancer early on to treat it. What are some of the modalities for treating the cervical cancer?
So what we're trying to catch is actually the pre-cancer before it becomes invasive, and that can be treated with a LEEP or cone procedure, which removes about 15 or 20, about this much of the cervix where that pre-cancer is living. Mm-hmm. If the cancer has invaded, then the treatment is much more dramatic. It's a complete hysterectomy with removal of part of the vagina, usually with chemotherapy and radiation.
So the bottom line is it's really important to get that HPV vaccine early on before exposure.
Yes.
So that you don't run into the situation of developing various types of cancers that can be caused by HPV.
Right. And cervical cancer is the only one we can screen for. We have no screening for head and neck cancers. We have no routine screening for anal cancers or other cancers that are caused by HPV.
How did they find the thing about it being under the fingernails?
They were taking skin samples from various different body parts to figure out where it was.
That's amazing. That is really amazing. Anything else you would like to share about human papillomavirus or the vaccine itself?
Really just that we can't lose sight of the fact that we have a prevention for something that we know causes 35,000 cancers every year.
And this is a covered vaccine by the insurance carriers, correct?
Yes, it's a recommended vaccine, and therefore all insurance carriers are mandated to fully cover it.
And so I'm sure we may have some viewers out there that may be parents or grandparents, and they hear about this, and they're going to want to have their child or grandchild get this vaccine. So is it safe to assume that everybody is getting it now when they go to their primary care or pediatrician? Is it safe to assume they're all getting it?
I would like to say that everybody is getting it, but unfortunately, people are not getting it as reliably as they ought to be. Mm-hmm. I think this has to do with people not realizing how important it is, people not realizing how many cancers are caused by HPV every year, maybe people having safety concerns, which now we really know are not based in fact. They're really unfounded at this point. We have very good safety data. And I think those rates will go up as time goes on.
So I understand that there is really a high prevalence of human papillomavirus. Why is this?
Well, it's a virus that is living on human skin, and it is very, very easy to transmit it through touching. And if you think about it, human papillomavirus, there are at least 40, probably more than 100 different strains that we've discovered. And we've really been talking about the ones that infect the skin of the genitalia, the head and neck, and the anus, and cause cancers in those areas. But common plantar warts and warts on the fingers and toes, that's human papillomavirus too. It's just different types.
Now, people will ask, okay, so can I get the HPV vaccine to take care of not getting any more warts on my hands or my feet?
Well, so first, a vaccine is only going to work if you haven't been exposed. So if you have a wart, no vaccine would work for that. But specifically, warts on the hands and feet are caused by HPV 1 and 2. Mm-hmm. And the vaccine is for HPV 6, 11, 16, and 18. So even if you were to vaccinate your 11-year-old, they could still get a wart on their foot.
It's interesting how all of the serotypes are named by numbers.
I think there's too many and too confusing to name them by names.
Oh, okay. That would be difficult. That'd be like the old woman in the shoe or something to that effect, for sure. Now, you mentioned that it's on the skin. Obviously, not everyone is born with this, but coming through the birth canal, you can be exposed to it if the mother has human papillomavirus in the birth canal. But that's fairly uncommon.
Yeah, so that is the way that infants will get that condition called recurrent laryngeal papillomatosis, or those growths in the windpipe, but that is a very rare disease.
Mm-hmm. Let's contrast the screening and the diagnosis of human papillomavirus with, say, breast cancer. How is it different? So we talked a little bit about screening for cervical cancer, and then that we can only, of the HPV-related cancers, cervical cancer is the only one we can prevent by screening. Because when we do HPV testing and Pap testing of the cervix, we can detect changes before they become cancer, treat the woman, and she will hopefully never get cancer. Unfortunately, when we're talking about HPV-related cancers in other areas, like the head and neck, we don't have a way to prevent those cancers, but we do screen for them. When you go to your dentist, you will often find that they're feeling the lymph nodes on your neck, and they take the cotton swab and they pull out your tongue and look all around. They're looking for HPV-related cancer. But that cancer would already be invasive, and they would be trying to detect it early. So that brings to mind two terms, primary prevention and secondary prevention. Right. Can you discuss what primary prevention is?
So primary prevention is when you prevent the infection before it happens. So that is vaccination. And that is the best way to do it, because that is just a little shot in the arm. Secondary prevention is when you have something that is precancerous, like a disease in the cervix, cervical dysplasia, and you prevent cancer. But to do that, I bring the patient into my office. I tell her, please remove all of her jewelry. I then inject local anesthesia with a big needle into her cervix while she is awake and talking to me. And then I take an electrified hot wire and cut off about 1.5 centimeters of the cervix.
So who wouldn't want to have the vaccine after hearing that?
Exactly.
Exactly.
And 330,000 women every year undergo that procedure to prevent cancer.
And if you get the vaccine, you don't have to end up going through procedures such as that. So
that is
every
certainly the
mother
goal.
should make sure that her child, and both male and female,
yes,
get the human papillomavirus vaccine.
Yes.
And let's be clear that boys can take it now too.
Absolutely. And head and neck cancers are actually more common in men and rapidly increasing in incidence. They've actually doubled in the number of head and neck cancers every year has doubled in the past 2 decades. And if the upward trend in that cancer continues, there will be more head and neck cancers caused by HPV than cervical cancers by 2020, which last time I checked was in only 5.5 years.
That's amazing.
Yeah.
Dr. Perkins, I want to thank you so much for sharing your knowledge of human papillomavirus and the vaccine with us. I really appreciate your taking the time from your busy schedule.
Thank you so much.
Thank you. For more information about HPV and vaccines for adolescents, visit our webpage at physicianfocus.org. I'm Dr. Mavis Jaworski. Thank you for watching.
This is Dr. Rebecca Perkins with a message for parents about HPV. Human papillomavirus, or HPV, is a leading cause of cervical cancer and head and neck cancers. In fact, HPV causes 33,000 cancers in the U.S. every year, affecting men and women. With the exceptions of the flu and pneumonia, HPV hurts and kills more Americans each year than all other vaccine-preventable diseases combined. The good news is that a safe and effective vaccine is available to prevent infections with the most dangerous strains of HPV. The bad news is that we're not doing a good enough job to protect our young people. Vaccination is the best prevention. As parents make the decisions about vaccines for their children, I urge you to make sure your children are protected. Talk to your child's physician about getting vaccinated for HPV. For more information on HPV, visit the Centers for Disease Control.
I'm Dr. Beth Warner.
I'm Dr. Eric Rhines.
End-of-life issues will reach every one of us at some time, either as a patient, a loved one, or family member.
As physicians who specialize in caring for elderly patients, we recognize how death and dying can affect seniors and their families.
That's why we urge you to learn about advanced care planning. It's important to prepare well for end-of-life care, making sure your preferences are known if you're unable to make decisions for yourself.
Advanced care planning includes creating documents such as a healthcare proxy and medical orders for life-sustaining treatment. They ensure that your wishes are fulfilled and provide peace of mind for your family and loved ones.
For more information and a copy of our brochure, Planning Ahead, What Are Your Choices?, visit the Massachusetts Medical Society at massmed.org.